Good morning, it's 8:30. I'll call this morning's meeting to order. We do have an agenda addition, so we'll just add that to when Kathy's here on item number 3.
I move approval of the agenda with addition.
We have a motion to approve the agenda?
Second.
And a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. Citizens to be heard. Are there any citizens wishing to speak on anything not on the agenda? Seeing none, we'll move into the approval of payment of bills and vouchers.
Move approval.
We have a motion to approve.
Second.
And a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. We have the minutes from March 6th.
Move approval.
Second. Motion to approve is presented in a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. All right, our next item is a request to waive a tax penalty and fee.
Mr. Marinucci is here.
Mr. Marinucci is here. If you'd like to come up, we do have your letter. You may sit up here, sir. Good morning.
Morning.
We do have a letter to you that indicates that due to hardship loss that you've experienced in the last year, that's the reason there's been delinquent taxes. So what you're asking today is to waive the penalties of $247.68.
Right.
Madam Chair, quite some time ago, we had gone through a process of what we would allow and what we didn't, and clearly to me this meets the level of what we had set aside as our policy. And I noticed, Pete, in your letter that you're asking for the $247.68 in penalties and interest be waived. Our policy has always been to, in this particular case, to waive the penalty. I think, Brian, correct me if I'm wrong, or did we do the penalty and interest?
Penalty and interest.
Okay, all right, then I stand corrected, then that was my only question then.
That's a good clarification.
So with that, I don't think we need to, I certainly need no more explanation from Mr. Marinucci, so I would move approval of the request.
Second.
We have a motion to approve and a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. Thank you,
Thank you.
Mr. Marinucci.
Yeah,
Sorry
yeah.
for your loss.
Thank you.
Thank you.
Okay, moving into our item number 3, the authorization for step adjustment for an RN applicant. Kathy McCray. Kathy will do your agenda addition after this, if you don't mind. Good morning.
Good morning.
Good morning.
So this is the one, Commissioner Mojo, that we had delayed.
Yes.
Yeah, because we were entertaining some of the candidates that had applied. So we finished the process of the applicants. So as you can see, we have one applicant that we could hire at a step 5. And I've talked with Brian Berg about this as well. So with all of her qualifications, and of course you hear the whole song and dance about the challenge of hiring RNs. So that was the request for the one nurse. The second nurse is a rehire. It was a nurse that worked here for 6 years, and she has been gone for a period of time, about 6 months, I suppose, and the position that she took was a supervisory position, but it's not working out for her. It's not something that it's not her passion. So she wants to come back to our organization, and so we're looking at the rehire of her at the step that she left. And she can walk in and just do the programs. Typically in this area, Jamie's area, there's up to 2 years of training, so it's a lengthy training process. So the beauty of having her come back is she walks in and day one she can do the work.
Okay.
So those are the two requests.
On your first request, is that a match to the step or dollars that she's at hourly currently? I mean, I see
No.
that she declined the step 3.
The step 5 is still lower than what she's making, including her health benefits, but she has agreed.
Just
As-
under.
And then I see on the second one, I assume there'll be some training savings associated with that.
Correct.
You know, this is, Madam Chair, this has been an ongoing battle with us locally, trying to keep somebody on our, where we have the step 1 through 3 in most other instances. It's just hard to do with these nurses. I would move approval of, you want these done separately?
Yes, please.
All right, well, I would move that we approve the step 5 on grade 17 for case manager.
We have a motion to approve the first
Second.
and a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. So then the second would be a rehire for a public health nurse.
I'll make the motion.
We have a motion to approve.
Second.
And a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes.
Thank you very much.
All right, do you want to do your medical consult agreement?
Sure. We've been, since we lost our medical consultant at the end of last year, he was with Essentia, there was no one within that organization that really wanted to pick up the medical consultant, so we are working with Sanford, who had agreed to take it on a month-by-month basis. They are now in a position to sign an annual renewal because they feel like they kind of get an understanding of the needs. It's both public health, or 3 areas, public health, the detox program, and the juvenile detention program. So they're working on the final agreement. I looked in my email today, it's still not here, so I will have that contract sometime this week because the previous one, as you can see, expires the end of this week. So I'd like to get because to be seamless, we'll need that contract for Saturday, basically. So I'd like to get approval. for
Because
that.
we don't have that, I guess I would feel more comfortable with just extending the current contract until we actually have the annual one. I mean, we would still be covered. I just don't like to approve contracts without even having them. But if we could extend this one to beyond that time frame till the new one, the annual one comes in.
I can,
Do you want to check on it and then come back before the meeting's over? I mean, I agree with Commissioner Campbell. I understand that it would be on condition of the attorney's office.
yeah, and
To not
Jenny
have
has,
anything.
she has reviewed the previous one, or the one before that. The contract would be the same except for the fee would be
That's still pretty
changed, but
important.
yeah, right. So I can contact them and see if they would just do another week extension, or
Well,
would you like to
I
see
mean,
that?
it would, I think what I'm suggesting is, we authorize an extension just as a temporary deal till we actually get the full contract in place.
Okay,
So, until the contract is approved with the fees,
sure,
we would have to operate under the current fee schedule.
okay.
That's all I'm
Brian?
saying.
Yeah, Madam Chair and Commissioner Campbell, the only thing, I've had a few conversations with Kathy about this, and this is kind of a ginger contract. I mean, they weren't reluctant to sign it, but you've had to do some convincing in order to do this, and you've had to do some negotiations on it. I understand your concern, certainly, but my concern would, if they don't want to extend it, then we do not have medical coverage for this weekend. And
Where is that contract now? Do they have it?
Yes, they're working on, well, and I'll just be clear, they had removed the juvenile detention center, because the doctors were a little concerned about the medications for juveniles, particularly in that area with behavioral and substance use issues. I've had a discussion with them about what we would utilize the medical consultant for, and it would really be medical issues. It would not be, their primary physicians of those juveniles would be managing those medications. So that's where I needed to have them add the juvenile detention back in, because we must have a medical consultant for that area as well. So we just had the discussion yesterday about that.
Well, I'm gonna flat out say, I'm not gonna agree to approve a contract where it's fill in the blanks. I'm just not gonna do that.
Sure.
I need to have something that,
Well, I can go back to them and contact them today and let them know that this body would like to see the final version of the contract when it comes, and that you are approving an extension.
So
we
they-
have coverage.
okay, so now the extension now that isn't with Sanford?
That's correct, it is with Sanford.
So it is with Sanford, so
Right, it's been, as I said, a month to month.
I would think they're knowledgeable enough in business to know that I would think that they would understand why we wouldn't sign anything until we have the numbers in front of us.
Sure.
But I think they also understand the importance of us needing to continue the service, and we're willing to do that.
Mhm.
You know, so it seems to me.
They have to agree to the extension though, too, I
Well,
assume.
that's right.
So-
Well, sure.
They do, yeah. So I can see if I can contact them after we leave, and then come
Well,
back.
and even if you can find something out before our board meeting's done, is
Yeah, it's just
Sorry,
that they're
yeah.
working on it, they're going through their legal process, you know how that goes with the health
Right.
systems. So,
Madam Chair,
Yep.
Ms. McKay, do you know the month-to-month, is that calendar month to calendar month?
well, when they took the consultant, medical consultant over, they wanted to just go month to month so their physicians could get a sensibility about how this would work.
Okay.
So they were interested in, let's just say, a trial period with the contract, so that's why they did not enter into an annual agreement. They have since, after 3 months, have agreed that this makes sense to do an annual, because they're comfortable with the work, is what I'd say.
My question just would be if we could just enter into that month-to-month for the next month until that contract is finalized. And maybe the answer is you don't know because you haven't discussed that with them, but.
Well, they know that the contract needs to be done this week. They're fully aware of that, so their intent is they will get it to us this week. So,
I get, my only hangup is that they do know that it needs to be done this week, but we also don't meet until Tuesday, and it's a holiday weekend. I mean, that's my concern, and I agree. I think it puts a lot of pressure on our legal to say we're gonna approve it based on their review, and we don't have it. I mean, we don't do that with the bills.
mhm.
What are the other wishes of the board? I mean,
If we just postpone until you check and see what their situation is for.
See if they can find something out, I guess.
you know what,
I mean, they need a contract, so
I,
you gotta do something.
you know, I would maybe suggest that you go back to them and explain the dilemma that we have here, of not being able to approve something, or the contract in front of us with dollar numbers, fees attached to it. But or maybe what I would do here is offer a motion to extend the month-to-month through April with the ability to redo that contract earlier on an annual basis once we have numbers in front of us. In other words, what I'm saying is I'd be willing to, have this go back effective, at the end of March, but until we review it, we can't do it.
So there's a motion.
Well, I just had a question. This is a month-to-month thing. When did we approve this month-to-month thing? 3 months ago, or what? Did we approve that?
Yeah, go
I mean,
for it.
I'm not aware.
Yeah.
We probably did it, I was just wondering when, does anybody know when we approved it?
Madam Chair and Commissioner Gross,
We
I guess
need a
I'd have to
second.
go back and check which board meeting.
Before we
but-
discuss anymore, we need a
Yeah,
second.
you did approve.
Okay, I
We have a
second.
motion, but,
Second the
okay, we
motion.
have a second for conversation. All right.
Just for clarification, though, Madam Chair, Kathy, did they give you a figure for dollars? Because wasn't it going to be like $1,500 a month or two? Did you
Right.
get an exact figure from them?
Well,
I
they-
think the question, one of the main questions here is, what is the cost to the county for a service that's going to be rendered? And I think you have discussed that cost. I don't know if you've arrived at an exact one, or is that going to be in the
Well,
contract?
He stated the cost would be $1,500 a
A
month.
month, okay.
So I'm assuming that's what he will put in the contract? Yes, we did have that verbal conversation.
Well, when we approved this back 2-3 months ago, how long did we approve it for? Just month to month, or? I don't understand, I guess, what we're doing here, you know? How long did we approve it for? We must have approved it for something.
For length of
Yeah,
time.
right, and then an extended period of time, I'd have to look back as well.
What was the length? We don't know the length of time. I mean, so we know we approved month-to-month billing, but what was the length of time associated with?
Yeah, I
Yes,
think
March.
it was, I think it was, they went 30 days, and then I think they went 60 days after that.
Okay.
So, and that's when it ends the 29th. So the rate will change, I believe.
And that's the critical component here,
Right.
or what is that rate?
They stated 1,500, so I'm pretty sure that's what he'll put in the contract as well.
What are we paying now, 1,500?
We're paying 1,000.
Oh, okay.
So, we have a motion and a second, but also had asked if they could check on it before the end of the meeting, so.
Yeah, if
what-
they can come back.
What's
with
the,
something.
I can do that.
so we're,
Well, if they give
Gonna
it
table
some more
it?
information, I just
Can we just
withdraw
have a
my
motion
motion.
Huh?
Let's table it for a while, for a couple, I don't know, half hour or whatever, and see if they can find something out, or do you want to vote on this now?
We have a motion on, in
We
a
have a motion
second.
and a
We're gonna
second
have to
on the
vote on
table.
it, unless it's withdrawn.
I mean, I think my motion covers what we need to cover here, right? I'm saying that we wouldn't lose service. We're willing to extend this through April with the ability to, once the contract comes in, to even take it back to April 1, or the end of the other contract period, whatever this,
With the $500 bump.
well,
If
what,
they
we don't know what that number is. That's the problem.
if Sanford agrees to,
If Sanford agrees to that 1,500, then
no, if
that's,
Sanford agrees to an additional month by month.
Month at a grand or a month at 15?
well,
Well, the extension is to do it at the current rate with the ability to go back and revise it. And for one thing, if it's month to month, why do we lose our service on the 29th or whatever?
it's the end of March, the March 29th.
30 days.
Only Thursday.
Yeah. Well, or whatever that Friday is. Friday is the 29th, correct?
Well, I don't know, this is kind of a mess.
Madam Chair,
Yep.
the reality is, I believe they want the contract to be entered at the beginning of April because of the change in fees that their health systems believe is adequate for their work.
I mean, I understand that, I completely do, but. So, we have a motion and a second. Any further comments or discussion? Anything further? Otherwise, we'll vote. All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes.
Madam Chair?
Yep.
Just one concern, I guess, and hopefully they can find an answer by the end of the meeting today, because it's not very comfortable to go into the weekend without medical coverage on the medical detox. At least that's what's been expressed to me very very seriously. So I don't know if we'd want to call a special meeting or,
See what you can find out before we leave. If you need to come back on, we'll add you on and can address.
Brian, I fully agree with you that we're in an uncomfortable situation here.
Yes.
But the fact of the matter is, it's March 27th,
right,
and we're now have a contract that ends March 31st,
right.
and we're asked to approve a new contract
March 29th.
that we don't even have.
No, I know, it's a difficult situation, but
On the 29th.
Oh,
the more of the story is that the public health was really in a panic at the end of the year and really scrambling to try to get the medical coverage. And frankly, I don't want to say I almost had to beg Sanford to go along with this. So I'm hoping that they are good partners and say, oh yeah, we understand that we can work another month without this, and don't say, yeah, we've thought it over and we're not going to do it. I mean, that may happen, but I mean, I understand your concern on it. Just, we'll see what we can do.
What the motion stated and what can clearly be told to them is that we did not want to see the services interrupted.
Discontinued, right.
And that once the contract comes into place, the new one, we are willing to look at going back to
Right.
the ending date of March 29th or March 30th, whatever that is, and reconsider based on the new contract.
Right.
But until I see the contract,
And
Kathy.
Madam Chair and Commissioners, we would have had the contract here if we could have. The holdout is
Oh.
through Sanford, just so
Right.
you know.
Yeah.
Right.
It's been a process with their legal team and with their physicians, so it's been kind of.
I understand the dilemma you're in too. I
Challenging, yeah.
fully get that, but.
Commissioner Gross?
Well, I also see it says services will expire March 29th, which is Thursday. The new contract doesn't start till April 1st, so you got 30 and 31st that you're not covered, right?
Well, no, they'll correct that in the contract, so we'll be covered they understand that they need to cover the weekend, so.
Okay. Any other questions on that? If not, we'll move into your annual update.
Okay, I have a couple other members of the team. Some of our team is missing, but.
Morning, Bruce.
Morning, Bruce.
Good morning, Mary.
So Mary is our financial manager, as you know. Jamie is with as the nursing director of all of our nursing programs, and Bruce, of course, is environmental health. I'll just lead off by saying one of the things we don't often talk about is our public health requirement to do a community health assessment. Some of you may have been involved and maybe received a survey. We just started the process for our next community health assessment. So we provide surveys to residents and also stakeholders and government agencies, et cetera. So from our last community health assessment, we are just beginning the process of the new one now. But our last community health assessment, three priority areas came up that we could work on: mental health, obesity, and adverse childhood experiences. So as we have discussed, I think, with this board before, is we have a group. It's both Clay County and Cass County, and it is called Rethink Mental Health, and Rory Beal is in charge of that. So I'll pass those around, and it's actually on the last page. I don't know if I got any for you guys, but it's on the last page in the blue, and it's the work of what Rethink Mental Health is doing. So they're working on 4 areas, and it's a large group of providers. So it's focused on the mental well-being is focusing on capacities and support systems for individuals. So that's one group working on the mental well-being. The second group is prevention and early intervention, and one thing they're doing is working with the school systems to become more trauma sensitive. Now, this is happening nationwide, so schools are getting training on the trauma sensitive training. So our schools in Clay County as well as Cass County are sending teams to this training, and that will be quite effective, we think, in the school systems, and the schools believe that is necessary as well. Crisis and Treatment is working on the Columbia Suicide Severity Rating Scale. So we have many community members, police, ambulance, emergency rooms, public health, social services. Many agencies have had training on that Columbia Suicide Severity Rating Scale. So we can catch those that have a high propensity for that kind of that may end up in a suicide, that we can catch that at an earlier stage. And then the recovery support is support systems for those experiencing behavioral health and substance abuse issues. So that group is really working on a number of things addressing that priority area that we have in our community health assessment. Obesity is the second one we talked about, and as you can see on the front page, they're working on workplace wellnesses, school wellness, active transportation. They're working on community healthy food system, where they're looking at improving healthy food offerings for food shelves in Clay County. And then, of course, we're working on the tobacco prevention, and Jason, our tobacco coordinator, will be coming to all of the boards in the 4 counties and reviewing policies. I included the Barnesville Trail Plan. The public input is tomorrow, Wednesday, in Barnesville. So, and that is something that Public Health is working on along with the City of Barnesville and the Transportation Department. So it's making more pedestrian-friendly, bicycle-friendly, handicap accessible. So they're working on a number of things in that area. Adverse childhood experiences, for those of you who know or don't know, it's traumatic and stressful events. It can be abuse and neglect, but it can be many other traumatic events that children experience. And the more events and the more traumatic they are, the higher risks for these children as adults to experience social emotional problems, substance abuse disorders, diseases, disability, early death. So we're looking at what can we do about the adverse childhood experiences, which has been long researched and clear that we need to deal with that. So Jamie will talk about some of the programs. We have intensive home visiting programs to address some of those issues. So, and when Jamie talks about her program, she'll be talking about those. In emergency preparedness, another mandated area we have, we did, many people attended that complex coordinated workshop, including Mr. Berg. And from that workshop, we have identified that we need a family assistance center during any event with casualties. And public health is required under FEMA to work on a family assistance center. And that will be really to help families. It'll be a center where families can go to if they aren't sure where their loved one is or they're missing a family member. So that will be something we don't have plans for. We need to work on those plans. And that came out of that complex coordinated attack workshop. And we'll also be working with Brian Green, Josh, my emergency preparedness coordinator, and Brian will be working on that, as well as mortuary services. They're also working on situational awareness training, so Josh and Brian Green will be providing that to all of the county staff, so they are aware of, more aware of the situational awareness. And then we have our WIC program, and we do have about 1,450 participants a month, so we serve quite a few on that. The new thing that's coming out of the WIC program is to have an electronic card. Right now we give paper vouchers to those participants, but so next year they will be coming out with an electronic card for the WIC participants for the groceries and
Well,
things
how will
they
that
can.
work? Because the paper vouchers tell you what you can get each time. How is that going to work with a plastic card? Will you just have a list of what you can get?
Yeah, and the grocery stores are fully aware of what is eligible, so they've been trained over the
Right,
years
but
about
for
what
the
is WIC eligible.
individual is what I'm saying.
Fact sheet or something like that.
Yeah, and that's probably what they'll do. They haven't finished all the plans. It'll be in 2019, so I think they're working on those. Okay. I think that's all I'll say. We'll go to Jamie.
Thank you.
I was just thinking too, when you talked about that, it's nice to see the little labels in the grocery stores too, because it lets
Yeah,
the other
it's
public
confusing.
know.
I
These
know.
are
It
healthy
is.
foods.
I know.
Mhm.
I have a handout for you, and March is a month of celebration for public health nurses providing home visiting. And so I wanted to share a little handout for you, basically looking at first the perspective, the historical perspective, and actually public health nurses have been visiting homes since the 1800s. And it was kind of interesting, one of the nurses just asked me, so what did they do? And I said, well, a lot of it is the same. It's about health and safety. And our society has changed, so it's not so much about, well, it is, but not as much about the rodents that are causing diseases in the homes and the healthy water. But basically, back in the 1800s, the first term of public health nurse was coined in the United States, 1877. And the nurses went out to meet, and they were actually assigned to, they were called district nurses prior to that in Europe, but they were assigned to communities, and that's what they would do. They'd focus on the health and safety and things like food handling and basic general health and safety is what public health nurses did. And then they also dealt with people that had TB and, the illness as well. So they were kind of the extension of that local doctor, and they would go out to the homes. And that still is what we do today. We don't talk a lot about the details of what we do. A lot of it is because we can't, but whether it's TB or whatever it is, that's what our nurses are out doing. But the highlights for March are that today is actually the 18-year celebration of the first nurse-family partnership in Minnesota, and it was in Clay County. And so that is a nationwide evidence-based home visiting program. A lot of the goals are still the same. We're trying to keep people healthy and safety, but we've moved up to improving self-sufficiency. So the goals that the home visitors are working with the families is so that they can have a livable wage, which means continue their education and be able to support their family independently. So being a mentor and a role model is a big part of what they're doing. So it seems like it's common sense, but they don't have the support systems in place, they don't have the education, they don't have the role model, and that's what this program provides for them. So we sneak in health and education at the same time of self-sufficiency. And then the other big thing for us is that we have the Healthy Families America program, which is also a national evidence-based home visiting program. And that program becomes accredited, and we just this month received our accreditation on our first try, which is almost unheard of nationwide, and that is our Partnership for Health Community Health Board that actually applied for the accreditation. So it's a team across our community
Is it
health.
4 counties?
Clay, Wilkin, Becker, and Ottertail. I'm pretty new to the team, so I had to think hard. And so those are the things that I just wanted to bring to your attention. We, in Clay County, are accredited as far as Healthy Families America, and we've had 18 years, one of the first, well, it was the first in Minnesota for nurse-family partnerships. Those are evidence-based home visiting. Basically that, of course, means that it's proven research. There's a lot of research to back up that they work and that they change outcomes for people, one person at a time, one family at a time. So, any questions about that?
What is the client load typically for your home
It's
nurses?
25 is kind of like the target is 25 families at one time, and it kind of varies because when they're pregnant, you see them more frequently, and then as their child ages, you see them less often. But that's kind of the average caseload. So.
Any questions for her?
I don't think I understand the evidence-based
And
idea.
that basically is based on research, and whether it's any field, education, they look at if we do the same thing over and over, then we get the same outcome. And so that's a very simple way if someone can help me out with that, but that's what it is. It's based on research. So it's a very standard plan of things that you address with an individual, like in a classroom. You follow the same curriculum, you do the same lesson, and you're going to get the same outcome, basically, hopefully the math skills.
It's to kind of help the behavioral change. It's to make healthy choices continually so that it becomes a habit.
Right.
And it's a learned behavior from
Yeah.
now on.
And the goals of the program are basically that there's a good pregnancy, healthy pregnancy, that they have a healthy delivery, that the child has health care, and that health leads to a completed education, that they help the families to complete, if it's GED, go on to school, and then they can move towards self-sufficiency, that they get a job that they can afford to take care of their family. It also prevents out-of-home placement, child abuse, neglect, those kinds of things, so.
Okay, but then it says evidence-based home visiting model. Does that mean that the whole thing, the basis of the thing is the visit that's made to the home? And an
Yep.
assessment is made at that point in time?
An assessment, but a lot of it has to do with interventions that they're doing. They're setting goals and achieving milestones and completing work, you know. Starting with, they set goals. What are the goals to the family? Well, I would like to get my GED so I can get back to school. I would like to be a good parent. They all say, I would like to be a good parent, whatever that means. And that means connecting them to resources so that they have adequate housing, they're not sleeping on couches, and they're not struggling with providing time for homework and those kinds of things that help them to be what they call a good parent.
And I'll just add, just a little bit to that is, like our Nurse Family Partnership that we've had for 18 years, they have studied this program for over 30 years. So there's been studies about what are the outcomes. So when they visit this family as the mother is pregnant and follow through till the child is 2, they have studied a large group of participants over 30 years in that program to see what are the outcomes long-term, what are the outcomes when they are adolescents, adults.
And that really speaks volumes. When I told the nurses I had 5 minutes to talk to you, they said, oh, we could give you quotes from clients that we saw, and now they're successful, and you know, they get a lot of feedback. They get cards, they get pictures of the successes, and they would love to share that with you sometime.
And in the future, the funding will be based on whether we have a research base, which is evidence-based. The funding will be tied to that. So if you have research, evidence-based programs, we'll receive the funding accordingly from the state.
Great, who's up next?
That'd be me.
All right, Chris.
I just want to give some information on the programs that I work with. You know, we have the delegation agreement with the Department of Health for food, beverage, lodging, all the licensed facilities with Clay, Wilkin, and Ottertail. Last year, between the 5 categories that we licensed, we issued 913 licenses. Taking on Ottertail and some of the additional things they wanted to do, we increased the number of places that we deal with now. Each year, MPCA requires an annual report on our on-site sewer program. Last year, we completed 66 compliance inspections, 61 site evaluations, and issued 90 permits for new systems or remodeling systems in the county. We also, through the solid waste ordinance, we have to go out and issue demo permits for anything that's being hauled to the demolition landfill, anything other than the pickup load. So it hasn't been as crazy as the previous years when all the flood buyouts were going on. There's a lot of houses, a lot of material being hauled out that we're taking a look at. So we issued about 50 to 60 last year. The lab, just an update on the lab. Since we no longer have a licensed lab a certified lab in the county, we have an agreement, cooperative agreement going with RMB Laboratories. They provide the test kits down at the same location that people would pick them up and drop them off, and then they also provide a pickup service. So we have gotten the word out that anybody wanting their water tested can come to the same location, pick up the test kits, 9:30 the next day, they come by, the courier picks them up and takes them back to the lab for testing.
Has that been a good thing?
It's been working very well.
Great.
We have not heard one negative comment.
Good.
So it's been working good. In January, there was a lot of media attention brought to the radon issue in the area. And since that time, we have given out over 150 radon test kits to residents in the county and the city and Minnesota residents. So there's been a lot of phone calls, a lot of
calling, just wanting more information on that topic, so. I guess that's about it.
I have a question on these, site evaluations and stuff like
Yep.
that. Do we have I mean, now we're doing Otter Tail, are there fees involved in this? I don't know, you
Correct.
probably cover fees later, I don't know, but I was just gonna, are there fees involved? Do we charge them more than Clay County, since you have to travel more, or?
We do nothing with the sewers in Otter Tail County. Otter Tail County, the delegation agreement is only for the food, beverage, and lodging program. Otter Tail County has, as Wilkin County, they have their own, like in Otter Tail County, it's called Land and Resource Department, and they take care of all the zoning and septic issues there, and then Wilkin has a separate office too. So it's just the food, beverage, and lodging that we deal with in Otter Tail County.
Commissioner Campbell?
As a follow-up to Commissioner Gross's question, Bruce, I know in the food and beverage, wanted to see reviews done somewhat in a timely manner, right? For license renewals, for example, you go in and you visit an establishment.
You mean
You do inspections, right?
re-inspections?
Yeah, yeah.
Re-inspections, yeah.
So by adding on Otter Tail, what does that do to your ability to?
Well, we have 3 staff that I supervise down in Fergus Falls.
Okay, so they do have staff there that?
Yes, they do.
Okay, all right, that was
Yeah.
my question, thank you. I was gonna say, because if you
We
had to
would-
do that with what you had here, that would have been a real
Yeah,
real
no,
trouble.
it wouldn't be possible.
So you basically supervise it for them, that's what you're doing?
Yeah, no, the state has I think it's 225 establishments per inspector is their ideal number,
Right, okay,
so.
okay, thank you, Bruce. That's-
Okay, Mary has our last item. Yeah.
Good morning. We thought we'd come up with some different ways of presenting some of our financial information to you. And the first page, what I did was I just did a budget comparison for 2018 and 2008, so I just looked back 10 years, just to kind of give you an idea of how our department has grown over these last 10 years. And as you can see that we've made a significant change in the size of our department, in the financial aspect of the different things that we cover. We've added quite a few new grants to our program, and most of them are our SHIP budget and our community wellness grants, and there's been a few others, and because we've become part of the 4-county CHB, we've been able to incorporate other grants too that were at one point part of only one county, and at this point now we're able to add some of the revenue to our county too. But you can see that we do have a pretty significant growth. I believe it's about, a 70% increase over, in the last 10 years. The one thing too that isn't reflected on this first page is that our county dollars have only gone up about 17%, even though our total budget has gone up about 60%. And the next page represents where we ended up for 2017, or pretty close to it. We haven't quite got all of our final numbers in yet. But you can see all the different sources of revenue that we receive for public health, and out of all of the revenue, our county tax dollars amount to only 10% of our total budget. And then we go to the third page, and this is a list of all of the grants that are funded through our 4-county Partnership for Health Community Health Board. We see the CHB budget, which is the total dollars that we receive from the state. And in the next column are the dollars that are part of, that are allocated to Clay County. And as you can see, not all the grants come into Clay County, but a good chunk of them do, and the total dollars kind of reflect that pretty close to half of the dollars come into Clay County from the CHB grants.
Any questions on this?
Did you
Go
want
on.
to do the detox?
You
Okay.
go right ahead.
Okay.
It's on roll.
Okay, the next page is a recap of our revenue for our detox center. And, you know, every year we come in and request county dollars to help fund this facility, and for us, it's kind of a guessing game because we don't know where our revenue is gonna come from. We do currently have contracts with Southeast and Fargo and the VA that are able to take and offset a lot of the county dollars that we would otherwise have to be spending. And you can see that the trend of our total revenue has been going up for the last 5 years. And then also the client fees that we're collecting from, client fees are coming from other counties. They would come from the contracts that we have. So, I mean, there's a definite trend there. But you can also look at the yellow line reflects the social services contract, which is where our county dollars come from. And it's kind of trending down, and which is probably a good thing for the county to see, you know, that little bit of a decrease.
Commissioner Campbell?
Mary, when did we increase the beds? When was that done?
About October of 2016.
16.
Okay, so that also is part reason why we're able to have increased revenues, right?
Mhm.
Correct.
Mhm. Yeah, we're seeing the numbers, the average numbers climbing there also.
The yellow line going down is a good thing as long as the other lines are going up,
Mhm.
Correct.
Mhm. Yeah.
right?
Yeah,
Correct,
and we've
yeah.
got, you know, we've got a very good relationship with Southeast, and they've done, you know, we've had, you know, very good success with them coming in, and, you know, the one nice thing is that they are a guaranteed payer for us. So for all the
Right.
clients that are here, then we get paid.
Any other questions on that?
Madam Chair?
Brian?
Just a comment. I'm looking at Commissioner Wayland here, and I remember when, 8 years ago, when I came over here, and it, nothing to do with me, but the comment was on the detox center, and it was $500,000 and $600,000 a year, and you guys said this could not continue. And the county attorney's office and social services and public health, I know Kathy took a trip to Wisconsin. Oh, no, it was just to St. Paul.
Thank you.
Where they went down on legislation to make that change so that we could charge. So this has really been a success story. If it had stayed on the same direction, you'd either had to discontinue your service, which I don't know what you did on that, but you'd been in the $1 million range, county dollars right now, and you're at 270 for 2017. That's a huge success in my view. So really hats off to them.
And then there's a statistical page that just kind of compares the client admissions for our detox center from the last 5 years. And you can see that in 2013, we were at about 1,100. 2017, we're over 1,600. So we've definitely grown, and our client average has grown from 5.7 to over 11.3. And for 2018, I think we're a little bit higher we're about 11.5, I think, right now. So we continue to grow.
Can I just ask one question? So the total client admissions for 2017 was 1,687, am I reading that correct?
Mhm.
And of that, 777 were unduplicated, in other words, they're first time,
They're counted once.
they're counted once.
Mhm.
Correct.
Okay, so still
So
a
it means
significant
seven-
number are still repeat
Yeah.
customers.
Correct.
Yeah.
Mhm.
But our number of billable days has doubled
Mhm.
since, 2013, and
Right.
that's where our revenue is coming from.
Yeah.
And the only reason we're just at 11.36 is the ratio of males to females and how we're set up. If we have female beds open, obviously we can't take male clients if they're full, so keeping that separated limits us, so. Any questions? Oh, fees, I'm sorry, we forgot the fees. Or I did, okay. So, Mary put out this fee schedule, and so it lists our fees. Our detox rate is $320 a day. That was updated in 2011. We have the contracts with Southeast and the VA, so we would look at potentially increasing that fee, not this year, but as we renegotiate that contract with Southeast and the VA, so that fee could go up. So it's been since 2011 that we've changed that. The agency fee, that's what we charge for all of those contracts that you see, childcare consulting, school nursing, juvenile detention. That was updated in 2016, so we did go up to $40 an hour. And we'll continue to increase that. The next contract cycle, we intend to go up to 43 an hour.
And that's, we're looking at for July 1st.
Correct,
Yeah.
yes. The clinic fees are really based on the vaccines and the costs of those, so those would remain the same, and we review those based on fees. And as well as the immunizations. The flu shot changes each year, so we look at what the reimbursement rate is and
Okay.
determine the rate.
All right.
What is the average stay of someone in there?
For detox?
Yeah.
As low as 24, but we try to keep them longer. We can keep them up to 72 hours unless they're on a commitment hold. If they're on a commitment hold, we sometimes keep them for 3 weeks. So,
I was just wondering, I mean, they're only there for 3 weeks, why would we give them a flu shot and stuff like that?
oh, no, those flu shots, I'm sorry, those are just for
For your regular.
for the public,
Yeah.
yes.
Okay, I'm thinking
yeah.
detox. Excuse
I'm
me.
sorry, no.
All right, Commissioner Campbell has a question.
I have one, not
Yes.
related to fees. I want to go back to your presentation, Kathy, in the area of crisis and treatment and the Rethink Mental Health, the one that's facilitated by them on that portion. Who's Rethink Mental Health again? Can you?
Oh, Rethink Mental Health. So that was a group, after the community health assessment determined that was a high need. So Rory Beal is the project manager for that. He is a Clay County employee, and it is made up of health professionals, schools, law enforcement, nonprofits, city and government officials. It's a large group across the whole metro area. So it's made up of all of the Cass County and Clay County, very large group, and then they broke out into those subgroups. So there's a large representation, behavioral and substance use providers, all kinds of people that are working in the mental health field as well. So there's, and the faith community.
How often do they meet, you know?
Oh, man, they meet, the large group, I think, meets monthly. The smaller groups may meet
Very good.
monthly as well.
Thank you.
Mhm.
All right,
Okay, thank you.
lots of good stuff, thank you. And if you can hear anything before the end of our
Okay.
meeting, come back, thank
Thank
you.
you.
All right, we're running behind, so we need to, we have a public hearing scheduled for 9:20, we need to do that.
I would move we open the hearing.
We have a motion to open the public hearing in a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes.
Good morning, Madam Chair, Commissioners. There was a two-page document that I left on you, in front of you earlier today. What this public hearing is about is a proposed amendment to the zoning ordinance. Over the course of the last 5 or 6 years, we have had people inquire about the ability to bring material in closer to the Fargo-Moorhead area to stockpile, material like sand and gravel. Kevin's well aware of this, clay material, be it from a dike project or whatever. Bring that in and have a place to be able to store that and utilize it for projects in the vicinity. Currently, our ordinance is not real open to that. You can stockpile and store that type of material in association with active gravel mines, but right now, we really don't have anything that says you can come in and do that anywhere in the county without an active mine. And if you're going to have it around the Fargo-Moorhead area, needless to say, you're not going to have an active mine associated with it, so. What the proposal has been was to make an allowance in Table 5 of the development ordinance, and to add a use, and that use would be the stockpile and storage and stockpile of extracted materials, including sand, gravel, clay, dirt, and other extracted materials. Other extracted materials could be riprap rock, boulders, whatever comes out of the ground. So we would add that use to the use table, and then allow that use in almost every district, zoning district that we have, other than shoreland and floodplain districts, and also the urban expansion district Tier 1, which is that district that is directly adjacent to the city of Moorhead and Dilworth. This proposal was heard at a public hearing at the Planning Commission on the 27th of February. The motion was made and was unanimously carried to recommend this proposal to you as the county board for your final approval, and here we are today at public hearing for that. One of the things that was brought up by a couple of individuals who were looking at stockpiling was we'd also like to take in concrete rubble that we could crush out on a periodic basis, generally once or twice a year, and that's utilized in the construction trade too. It's either utilized as base material or as material for parking lots. That is not included in this particular provision because it's already covered under temporary, a provision that we have under temporary tire and or waste collection and or recycling operations. So if we consider that concrete crushing a recycling operation, we already make provisions for that, so we don't have to include it in this particular amendment.
Commissioner Campbell, do you have a question?
Yeah, I do. I have a little concern here when it says about, and any other extracted materials. Sometimes we end up having contaminated soils. It becomes extracted material. Does that mean we're going to allow them to be temporarily piled in certain areas? It's in any other material. And I wouldn't want that done over our wellhead protection area.
That is something that was not brought up, and I guess.
But that's the problem I have with the
Yeah.
language, is any other extracted materials. And we oftentimes, in our communities, especially when you look, you even look at what we had done here when we excavated our own lot here. We found contaminated material.
And right now, most of that actually goes to our landfill.
Yeah. But the fact of the matter is this says they can.
Yeah, because that would, I mean, if they have clay or dirt that has contamination, it doesn't differentiate from it. That is something that we.
Jenny?
Yes, thank you. So extractive material is defined in the Clay County Code, so that's what we're using as a definition.
Okay.
And extractive material would be sand, gravel, rock, industrial minerals, other non-metallic minerals, and peat not regulated under Minnesota statutes annotated section 93. So I'll double check that, but I believe that section 93 is, let me just look. But I think it covers that concern. But we had not anticipated that particular scenario.
Well, I hope we can address it somehow.
Yeah, we'll have to, because that's a very good point in terms of not wanting it to encompass something that the ordinance wasn't intended for, so.
Commissioner Gross?
What are we doing now when someone stockpiles something? I mean, if they just pick out a spot and they stockpile, do we do anything? Do they get fined?
We don't come across that very often. I guess I don't recall that we have come across it. Well, I suppose.
So no one's doing it now, but now we need an ordinance to.
We've had people who have specifically requested the ability to do that.
Okay, all right.
If you drive down Main Avenue Southeast or Old Highway 52, you can see a similar operation just south of 12th Avenue. Strata Corporation has got a stockpile facility right down
Yes.
there. Most of the operators, you know, they do their stockpiling at the site, but we've got some smaller operators right now that, I don't know if they're buying material from larger operations, but they want to bring it in closer so that they don't have to be, you know, running 25 miles out to a site to obtain that material.
And is there anything that talks about length of time?
Well, it would be considered an interim use permit, so we would establish some end date to it.
Okay, so that would be done
as
through the
part of
permitting process?
process, right.
Okay.
It's important to note that we did have a subcommittee that met a couple times on this
Yeah.
that offered feedback as well, so.
I guess I'm just interested in our attorney's opinion on the.
Yeah, I think what we'll need to do, because the section in question that the ordinance is pointing to has to do with reclamation. And so it's the soil that's stockpiled for reclamation processes after extractive uses. And so I think what we'll need to do, Commissioner Campbell, to satisfy your concern and very legitimate concern for the whole county, would be to add a definition of extracted material and specifically exclude any contaminated materials, and we'll point to the statute that talks about that.
There is a process that the state has for removing contaminated material, and that should be followed even within our ordinance.
Right, and so we'll point to that Minnesota statute in the definition.
Very good.
To make sure that it is set aside from what we're talking about here. And I certainly can draft that and have a final version submitted to the board yet this week.
Okay.
Any other questions or comments? Are there any members of the public that wish to speak on this ordinance proposal? Any other comments from the board?
Move to close the hearing.
We have a motion to close the public hearing
Second.
and a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. All right, so
We don't have to act on this then until,
Well, I think the board could do either. I know there's an application currently pending for this particular interim use, so I know the planning department would probably like this acted upon. So you could do that contingent on the writing of the exclusion into this proposal, or if the board is not comfortable with that, it would have to wait and come back next week.
well, I guess if you're going, we have to depend on you to
Yeah,
write it anyway, so
Right.
I would be fine with moving forward with a contingent on,
As amended.
on the amendment. I would make that a motion.
Second.
we have a motion and a second, as worded by our attorney. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. Thank
Thank you,
you.
Madam Chair.
Thank you, Tim.
Thanks, Tim.
All right, we'll move back up to our request for approval to purchase the voicemail system. Tim and Jocelyn, hello?
Good morning. 2 weeks in a row.
You just like seeing us.
A little background first. Last year, we were notified by Microsoft that our current voicemail solution would no longer be supported after June 30th of 2018. So our IT team started looking into solutions, and including Mark and Rory, and especially Jocelyn, who's done a lot of the technical research on this and has spent a couple hours on the phone hundreds of hours on the phone with vendors. So we've met with many vendors and have had many quotes and many follow-up calls and meetings with these groups. And this is what we came up with for a solution to replace our current system.
Okay, so, it seems the total cost for the new voicemail will be $66,511.25.
Correct.
Coming from the internal service fund,
Yes.
and then including the 5 years of maintenance.
Correct. And I had met with Lori Johnson regarding this too.
Okay,
I'll move to approve.
we have a motion to approve. And a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Passes. Thank you.
Thank you.
Highway? Morning, Dave.
Good morning.
All right, so your first item is approval of an MOU with the City of Sabin for local road improvement plan.
Yeah, the county has agreed to sponsor Sabin's project. They did apply for a local road improvement grant in the amount of $255,800. We have met with them and talked a little bit about the project and responsibilities, and we put together our typical MOU document that describes roles and responsibilities of the city and/or the applicant, and roles and responsibilities of the county. For the most part, they are going to take care of the project. They're going to take care of all the preliminary engineering, all the construction engineering. We have agreed to oversee the project, be the sponsor. We could, it's a small enough amount where we could cash flow that and then request the monies back to the county in a timely manner. We also kind of felt in-house that if the road does need additional right-of-ways that would become permanently county right-of-way, we would acquire it and purchase it for two reasons. One, make sure it's done right, and then two, it would end up being county property. There's not the project isn't designed yet, so there's kind of a feeling we may not need much, if any, additional right-of-way, so it might be kind of a non-issue.
Here. All right, what are the board's wishes?
I'll make a motion.
We have a motion to approve the MOU.
Second.
And a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. Item number 2 is the approval of the 5-year road construction plan. And you did have a meeting on this last week, correct?
Yes, on the 21st, we did have a public input meeting. We went through a couple of different highway tracking committee meetings as well. Final approval of that was on March 6th. We made a few changes, and the meeting on the 21st, the public input meeting, wasn't as well attended as it had been in the past. Commissioner Gross and Commissioner Campbell were both there, and about a half a dozen other, mostly township officials that have an interest in their general area of the county.
How do we advertise that meeting?
Newspaper, a couple ads, and then probably on our website.
Do you do it on Highway Department's Facebook page?
I would think, I guess I don't know for sure. We certainly could, though.
I think we should
Oh.
get maybe creative in how we advertise that. There's some people that I thought would have known about that didn't hear about that, so.
Oh, we announced that meeting at the township meeting.
Right, but not every citizen sees their township officer all the time.
Sure. Yeah, we definitely put it on our Facebook page as well.
Thanks.
So I don't know if you want me to go through year by year, or if you have general questions.
I mean, we have 2 members from the Highway Committee on
we've-
here. I think we've pretty much been up to speed on some of these. I think my only comment is that I think as we continue to see, I know that the eastern part of the county doesn't see the commuter traffic like the western part of the county does.
Sure.
But in terms of the load size and the damage that it may be doing to the road, I think that just needs to continue to be on the forefront of discussion, is how those roads are holding up. And I appreciate the Downer project. I think that will really help.
I'd move approval of the 5-year plan.
A motion to approve
Second.
and a second. All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. Thank you.
I do want to discuss, there was good discussion, and there is a plan of action coming up with Dave, submitted a plan of action of some of the concerns, and we talk about the eastern part of the county. There were some concerns about gravel trucks coming in from other counties and stuff like that, and we do have a plan on looking at that, and there are roads being worked on the eastern part, so.
I do agree with your
It's a good plan.
follow-up plan. I think that's an excellent idea.
Yeah, I just was looking back at my notes, and, the last several years, I had jotted down some things, and I didn't feel like I maybe communicated back to those people that had the questions, and if there was repeat questions, I felt like we should be getting back to these folks.
Thank you. Your next item is an agency agreement and resolution for the County Road Safety Plan project.
Yeah, about a year and a half ago or so, I put Clay County's name in the hat for an upgrade to our county road safety plan, and the biggest reason for that is we don't have a lot of real tricky roadways and curves and different things going on. I mean, Clay County's pretty straight, all the roads are north and south, east and west, so we were kind of running out of areas to spend the safety money, and every year there's federal dollars that have to be spent on safety, so I thought it'd be good to get our safety plan updated. It's 80% federally funded. We're responsible for roughly around $9,000, and I just feel like it's a good idea to try to get some more eligible projects so that we can be at the table getting federal dollars in Clay County.
Okay.
I'll move to approve resolution 2018-17.
We have a motion to approve the resolution as presented and a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes. Thank you.
Thanks.
All right, Julie, we'll sneak you in before we have our closed session. You have a request to fill a vacancy for a full-time corrections officer.
Yes, we have one of our officers retiring. He's been with the county for 22 years. He's retiring at the end of the month, well, actually the end of April, and we would like to get going on that process. The information he has is something that's pretty detail-oriented. It's a court officer, so we'd really like to get somebody in there so they can start learning all the information that he has.
Okay. So there's a payout that will be approximately $12,000, but I'm sure we'll see some savings.
So you'll
after
see
that.
some savings in your employee, yeah.
Okay.
Yep.
Move to approve.
We have a motion to approve.
Second.
And a second. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed? Motion passes.
Thank you.
All right, we're a little behind, but now we'll move into our closed session.
Move to close.
We have a motion to close
Second.
and a second. Any further discussion? All those in favor signify by saying aye.
Aye.
Opposed? Motion passes. We are closed. All right, we'll continue now with committee reports. Commissioner Wayland?
Okay, let's see, I had diversion authority meeting last week, and just, some discussion on where we're at in terms of filing a new plan with the DNR, and then just updates from staff and where we're at in terms of hiring an executive director and that sort of thing. And then we had a solid waste advisory committee meeting, and had updates from the staff there. Had a pretty lengthy discussion on plastic bag issues we've got going on in the county, which seems to be a never-ending issue and problem. But Kurt and his staff continue to work on it, and are doing a good job there, I think. And hopefully we'll get some things resolved there in the near future. And let's see, I think that was it for me.
Thank you. Commissioner Gross?
Wednesday morning, I took the tour that was part of the watershed deal, that the meeting that was going on Wednesday and Thursday that I attended, but we took that tour with Moorhead, and I really gotta say that was a very interesting tour. I mean, even though I live around here and you see what's going on, it was an interesting tour. Mayor Williams, Dr. Zimmerman, and Steve Moore, and Dennis, they gave a good presentation, and Jerry Van Amberger also gave a good presentation of the watershed. It was a good tour, glad I went on it. The watershed board meeting, I don't know what to report on that. I mean, there's just a lot of stuff going on. There are different programs of water management and stuff like that, what they're doing and what different watershed boards are doing. Wednesday, I had the Historical Society also. There was just we had a routine meeting and nothing new that happening there, just routine meeting of ongoing, this stuff going on. And also Wednesday night, we had that 5-year plan that Dave talked about that we approved today, and you had mentioned about whether it was posted, and I do have a copy of a posting that was in the newspaper, so that was, it is well publicized, so people should have been aware of that. That's it.
Commissioner Haney.
Thank you, Madam Chairman. On Tuesday, I attended the Adult Mental Health Local Advisory Committee, and we had various reports, including A Place for Hope. There are 557 members of the Adult Mental Health Local Advisory Committee, but the list needs updating due to deaths and departures. We had a discussion about barriers, reports on what barriers the different organizations have to providing care. And then on Wednesday, I attended the Diversion Finance Committee over in Fargo, and they were dealing with issues on the financing and how it relates to what's remaining of the fiscal year as far as the federal government and whatnot. And that was all I had.
Okay, thank you, Commissioner Campbell.
Okay, thank you. Last Wednesday morning, I along with Commissioner Mojo, we were there to go through the jail correctional facility and law enforcement tours with the Moore Business Association. There was a really good turnout there. Then that day we also, Grant and I met with Kirk and the new Otter Tail County Solid Waste Director. And then we had our 5-year plan public meeting that day, which has been discussed. We also had a diversion public outreach and a land management meeting that day. And I think both of those, or actually I think Grant talked about the public outreach, land management. We got some updated information on the mitigation plan. And for those who may be wondering if there is a mitigation plan, there certainly is. It's I think it's 160 pages so far, and that's a living document that's, as we go through the Plan B, that's constantly being updated and changed, and it'll be updated as we go through the study for the land acquisition issues and flowage easements. And on Thursday, we did have the Solid Waste Advisory meeting. Commissioner Whalen reported on that, and then we did have the actual Diversion Authority meeting that day, and that one, we got reports from the individual committees and updated some contracts, and I got an update on the executive director search. And then last night I attended, I was asked to go to the Buffalo Red River Watershed District as a Diversion Authority member. There was a presentation on Plan B. I know Commissioner Mojo was there as well, and that was those meetings are going well in terms of giving these updates, and there's an awful lot of them going on. That's all I had.
Okay, thank you. Last week, as noted, I also attended the tours with the Moore Business Association. I think that was a good thing to have a dialogue with them on how that's coming, since they were so supportive in the pursuing of a sales tax. I then attended the tour with the Minnesota Environmental Quality Board, and to have those individuals come to Clay County, the Commissioner of the DNR, the Commissioner of the Agriculture, I think is really important to show them things that are going on. We toured the Minnesota Green Step, or Moorhead's Green Step City pieces in terms of environmentally friendly lighting systems, and also showed them the solar panels and wind turbines, and capped it off with the Oakport flood mitigation as they continue to seek some dollars from Minnesota DNR. It was important to show them that, so that was a good tour. And then I also attended the flood damage reduction work group conference good conversations in terms of water management and planning and updates on what those, that mediation agreement 20 years ago, where a lot of the presentations stemmed around that. I then had a conversation with Bill Schwant from Moorhead Public Service to clarify some issues in regards to a planning and zoning permit that is being appealed by Moorhead Public Service. And also attended the land management meeting of the diversion. We haven't met since December, so it was up to speed on what's happened since then. Obviously, the Plan B, but most importantly, we talked about the flowage easement valuation study. It's expected that phase 1 of that by Crown appraisals will wrap up by August and start phase 2 in September. So I think good dialogue in terms of addressing some of the concerns for gaps that I've heard from people. The wheels are in motion to get some of that in print. And attended the Buffalo Red Watershed Advisory Committee meeting on Friday. A good dialogue with all the different representations of the watershed. Had a financial update. As we know, they're doing lots of good work there. There was some comments from advisory members in terms of accounts payable. There's some smaller projects, several in terms of dollar amount less than $5,000 that have just been billed out and not collected for 3 or 4 years. So advisory members had kind of urged Bruce to try and get those wrapped up. And then just an update of all the different projects that they're doing. Yesterday, I did attend that Buffalo Red River Watershed main meeting. It was important to hear. We got an update on some of the issues in terms of permitting issues. There's culvert washout at Barnesville Township along that Whiskey Creek that they are going to try and fix so they don't have to seek another permit from DNR. And then just talked about the different studies that they're expecting to take the next 1 to 2 years on things. And then obviously the Diversion Authority was there to present Plan B. I appreciate, after hearing that presentation 3 or 4 times, that as the questions from the different parties that they're presenting to, they've added those question and answers to their presentations. So obviously there's still a lot of turmoil in regards to what that looks like, and we'll see what DNR says going forward. The only other thing I had was that the watershed is in the process, since we've all signed consensus on the one watershed, one plan. I was asked to claim an alternate for me in the next couple months, and I had to do that by Friday, so I did appoint Frank to that, since Frank and I have been kind of part of that dialogue a lot. So I would like to see if we could get this board to formally approve that.
I would so move.
Okay, we have a motion and a second. Any further discussion? All those in favor of that motion signify by saying aye.
Aye.
Opposed? Motion passes. Thank you. All right, Brian.
Madam Chair, if I didn't hear who made the motion on that, and I don't know if Colleen got it or not.
I made the
You made the motion?
And Grant.
Grant second. Very good.
Sorry.
She listens closer than I do. Thank you.
Not surprised.
The first thing I have, we have, Darren and I have been working on a little program for May 9th for the department heads involving Sand Creek and some training for them for a couple hours. And we thought it would be good that we can certainly invite you folks to attend that, but then that we maybe have a planning session in the afternoon for a couple hours. We'd have lunch out at CCRI again, and then maybe have a planning session in the afternoon. You know, we've called it goal setting. We've labeled it different things in the past, some training and things, but I think it would be good to sit down for a couple hours and talk about some things going into the future. So if May 9th is available to you folks,
That's an
would that work?
MRC meeting at 11, so. ITV, I don't know. One of us probably can.
What time frame did you say?
we were looking at lunch for the commissioners and then going into the afternoon.
Okay.
I got the radio meeting that day.
Up north?
At the
Okay.
Peak River, yeah.
Well, this was just kind of a follow-up, so
Could
we
you do
just
it
picked on
Tuesday?
9th. We can do a different day, so whatever's, yeah, that's not
my.
my,
The other guy, I don't know if that Tuesday, the 8th works better for them after board and into the afternoon, I don't know, but.
Afternoon's okay for me,
on the 8th?
on the 9th.
Oh, on the 9th? Yeah, that's what we'd be looking at, is the afternoon for the
but if
commissioners.
Jim's
but-
gone.
I mean, if it starts at 1, something like that, 12:31,
Does it work?
I mean, I don't have no problem with that.
We can do that,
I mean, you can start, I mean, I don't have to be there for lunch, if you're doing lunch first, or whatever.
Okay.
No big deal, I mean.
Well, if it works for Sand Creek, I guess.
yeah, and that's what Darren had worked with Sand Creek on, some open dates, and that was one of
And
them.
it works with CCRIs.
And then we worked with, yeah, CCRI. But the afternoon session was kind of, because then they're gonna go up here, they're coming up here, or staying down there in the afternoons. Coming up here, Sand Creek is for other employees and supervisors and things, so that's why we piggyback on
Great.
that.
Well,
But
that-
we could make a different day, that, we just kind of picked on that.
Does
We'll
radio
try for the
board-
9th?
Does radio board offer ITV?
I don't know.
Well, they do, yeah, sometimes, so I don't know about that particular date, but probably.
You could maybe ask if you could just join ITV.
Okay.
Morning.
Work for you?
Okay, we'll stick with the 9th, or plan for the 9th, okay?
When do you plan on starting, what was the date, time of that, or don't you?
Well, in the afternoon, it'd be like 1 o'clock, 1:30.
Oh, no, problem.
Yeah, because we'll go with the Sand Creek in the morning, then we were gonna have lunch there, then we were gonna go into this session in the afternoon.
Go for it.
9th gonna work for you? We can certainly make it later.
I don't think I should, I mean, I'll make something work, yeah.
Okay. Okay, very good.
Maybe.
I did too, I didn't attend the tours for the MBA last Wednesday morning, but I was there as well, so I
Thanks for your
spent
work
quite a
in
bit of
making that
time.
happen, though.
Oh, you're very welcome. I spent quite a bit of time with that, because it ended up, to tell you what, you guys didn't say this, and I know both the commissioners were there that mentioned it, but there were so many people that we had to do 2 tours, so there was a really
Yeah,
interest from the MBA, so they went around twice that day, so they were really busy. I did attend that tour in Moorhead for the Environmental Quality Board. I did not stay in the afternoon for their meetings. I got back here to do some additional work. Michael, a reporter from the Barnesville paper who has done kind of a continuing update on the correctional facility in the LAC, was in and did a little update on that. So I imagine it'll be something in the Barnesville paper again. And also, I think he plans to attend the media event on Thursday afternoon. So.
Did you happen to tell him about the small cities meeting tonight?
No, I didn't. No, I didn't. And we had a follow-up meeting after the PIC meeting last week. We were asked to do some follow-up and get some figures tied down on the budgets and a follow-up with DOC. We did some of that, and we had a follow-up meeting on that, so we should be ready to go this morning at the PIC meeting. I attended the diversion meeting last week. Met with one member of the recorder staff, plan to meet with a couple others to talk about how things are going in the office and where they see things going. Darren and I had a couple different meetings on some personnel issues that have taken some time, and then we had new hire orientation on Monday. So that about concludes my report, Madam Chair.
Okay, is there anything else?
Do we need to do anything more with Kathy McKay's request, or is that, excuse me?
Oh, no, Madam Chair, I did receive a message from Kathy that said I just requested an extension. Hopefully I can get a copy back today. So we'll work through that. And I guess we feel comfortable that we're covered on it. So.
Commissioner Campbell?
Yeah, Brian, hopefully you can follow up if you have to with Kathy, even if it's a phone call to whoever this person you're negotiating with on this contract, and assure them what our intentions were.
Sure, absolutely. To extend the contract.
Yeah. So it's just a matter of, from a formality standpoint.
Right, yeah.
I mean,
No, I think we'll be okay.
Even if it's a matter of waiting till the 2nd, I mean, whatever our motion is to carry on.
Right.
Okay, anything else? If not, we are adjourned.